Hello, this is Faye, and I just wanted to stop in to talk to you very, very quickly about the American Rescue Plan. The American Rescue Plan is designed to help those of you who get health insurance or would like to get health insurance through the marketplace to get that coverage that you need to take care of your health. Actually, the American Rescue Plan was signed into law on March 11th of this year. ARP, as it is known, makes major improvements in access to and affordability of health coverage through the marketplace. It's done this by increasing eligibility for financial assistance to help you pay for your marketplace coverage. There are some important points that you should know about these changes. The new law will lower premiums for most people who currently have a marketplace health plan and expand access to financial assistance for those of you who may not have been able to receive subsidies in the marketplace. Under the new law, the American Rescue Act, many people who buy their own health insurance directly through the marketplace will become eligible to receive increased tax credits to reduce your premiums. Starting April 1st, consumers are able to take advantage of these increased savings and lower costs. Premiums after the new savings will decrease on average by $50 per person per month or by $85 per policy per month. 4 out of 5 enrollees in marketplace plans will be able to find a plan for $10 or less a month after premium credits. And more than 50% will be able to find a silver plan for $10 or less. Now, that's a substantial difference from what you've seen in the past. For consumers who are eligible for premium tax credits to help purchase a marketplace plan, an individual or a family's tax credit amount is calculated based on these factors: household total expected income for the year, total number of people in the household that file taxes together. So as an example, there may be 6 people living in the household, husband, wife, and 4 children, but one of the children may be working and file their own taxes. So that's a separate person to consider and would not be considered in the household income of the husband, wife, and the other 3 children. The premium amount of the second lowest cost silver plan in the consumer's area in the marketplace. This is the benchmark. The benchmark plan is the silver plan that's used to calculate premium tax credits. It is not related to the plan that a consumer actually chooses. The tax credit calculations uses a percentage of the household's income to calculate those premiums. This amount is limited based on how the household income compares to the federal poverty levels. Now, prior to the American Rescue Plan, households had to contribute up to 9.83% of their income to pay for health insurance premiums to be eligible for tax credits. Now, no one will be paying more than 8.5% of their household income towards the cost of the benchmark plan or a less expensive plan. So let me repeat that. Under the American Rescue Plan, individuals and families may be eligible for a temporary increase in premium tax credits for this year, 2021, with no one paying more than 8.5% of their household income towards the cost of the benchmark plan or a less expensive plan. What this means for you, the consumer, is that you will be eligible for higher tax credit amounts to help cover your marketplace health plan premiums. Some consumers who are making more than 400% of the federal poverty level may not receive tax credits if the cost of the benchmark plan is less than the 8.5% of their household income. When consumers enroll, or when you enroll in a plan, you can choose a plan that is the same. You can choose a plan that costs more, or you can choose a plan that costs less than the benchmark plan. The 8.5% cap is used to calculate this increase in premium tax credit amounts, but the cost of the plan that you choose to enroll in may be higher or lower than the benchmark plan. There's some things of note for you to consider. Many consumers with household incomes from 100% to 150% of the federal poverty level may have zero premium plans after tax credits. Making this work for you, here are some questions that I've received that I'm going to answer. When will the extra tax credits be available? The increased premium tax credits are based on lower income contribution percentages along with expanded tax credit access to consumers with household incomes above 400%, and they are all available now. Extra tax credits for consumers who received unemployment compensation will be available this summer. Question: if I'm currently enrolled in a marketplace plan, how do I receive the additional tax credits or lower premiums? If you're currently enrolled in a plan, then you should re-enroll or take a look at the new subsidies. You may enroll in the same plan with the same company and have a lower premium, or you may enroll in a different plan with a different company. But now is the time for you to start to look at that. If you live in a state that operates its own marketplace, you should contact the state marketplace website or call the state marketplace center to get more information about state-specific marketplace. Question: if I'm currently enrolled through the marketplace, what will happen if I do nothing? If you're currently enrolled in the marketplace at the moment, right now, you have the choice of waiting until you file your taxes next year in 2022 for the tax year 2021 to receive any additional premium tax credit amounts and reconcile all of this when you file your 2021 taxes. However, we recommend that all enrollees come in, update your applications, review your plan options for 2021 during this special enrollment period, which runs through August 15th, because you may be able to choose a plan with lower out-of-pocket costs, or one for the same price, or one where you're going to have less copays. Question: if I don't have coverage, when should I apply? The answer to that is right now. You should pick up the phone right now and start calling me. Consumers who need coverage should apply right away and select a plan before the end of the special enrollment period. Coverage starts for you on the first of the month following your application submission. Question: if I'm already paying a very low premium or no premium, should I take any action? Actually, you still should look at what's available, because if you even have a zero premium now, you may see that your generous cost sharings, because of these new subsidies, can lower your out-of-pocket cost, and benefits may have changed, so you have lower co-pays or co-insurance. Question: will healthcare.gov automatically update premium tax credits on behalf of a current enrollee? If you don't take any action, there may still be additional benefit for you that will be reconciled in 2022 when you file your 2021 taxes. But if you are like me, you want to see your money in your pocket now rather than wait to see if you have a tax credit next year. So what do you need to do, and what do you need to know right now? You need to take the step to get a free quote and a free look at the plans that are available in your zip code. There's very little information that's necessary, and if you would text me at 407-340-6282, you can have a free quote, no obligation. We'll look at all of the plans that are available. I'll tell you the ones that are coming up. Or you can go to my website, fayeteaches.com/ACA Health-Insurance. That's fayeteaches.com/ACA Health-Insurance, and get a free quote there. Go in and fill in your information and do a free quote there. This is Faye, and I just wanted you to know about the changes that might affect your life and might affect your health insurance coverage. So reach out to me whenever you have a moment, and let's get this done. Thank you so much for listening. Have a great evening.